Lives Saved, Futures Rewritten. It's a powerful statement from a center in Middle Tennessee using AI to screen for cancer and heart conditions.
Yeah, this is cutting edge technology, and already it has saved lives. Today we're here with Longevity Health's medical director, Dr. Kevin Young. Welcome back.
Thank you. Nice to be back. Appreciate seeing you ladies again.
Well, we really enjoyed our conversation with you last time, but for those that may have missed it, you guys just opened earlier this year, so fill us in a little bit about your mission.
So yes, we opened about 5 months ago and partnered with our founders, George and Megan Shin, to bring the most current state-of-the-art imaging technology around to help prevent heart disease, catch cancer early, and help people live longer, healthier lives.
Yeah, and it's incredible. And everyone listening out there, they are Tennessee's first AI-powered heart and cancer screening center. You guys say it's the gift of life. So explain the difference between the calcium score and heart scan that you guys are doing.
That's a great question. A lot of people are familiar with calcium scores. Those have been available for quite some time, and they were a useful tool in the past, but this technology is just light years ahead of that older technology. Even Dr. Arthur Agatston, who was sort of famous for also writing the book, The South Beach Diet, he's the one who created the calcium score, and he's one of the nation's biggest proponents of this technology that we're now using. I sort of use the funny analogy that if you were traveling across the country, you could do it in a horse and buggy, that's a calcium score, or you could do it in a jet airplane, which is the technology that we're bringing to this detection of heart disease.
And I know you say prevention is key, and you shared with us just before the show started this incredible story of one of our Local on 2 viewers out there that caught our last segment, whose life it sounds like you may have saved. Please share that story.
Well, I'd say we did, because bringing this technology to light and making people aware of what we're able to do was really critical. But this is a true and pretty neat story. When we were here a month ago, it was a Tuesday afternoon, and there was a gentleman who had gone home from work, I think to feed his dog, and he saw the segment on TV, scanned the QR code, and while I was still talking with you ladies, he called our office, scheduled an appointment for the next day, came in on Wednesday, had a scan done. He was an asymptomatic 52-year-old, just had a feeling maybe he should get his heart checked, and he had a critical blockage, what we call a widowmaker, and we brought him in on Thursday. I sat down with him, went over his images, told him what we needed to do, and he said, I think missing or going home from work saved my life, and I didn't understand what he meant, but he said that he had seen this segment on TV, and that's what led him to call us. So we were able to get him into the cath lab, get him taken care of, and he's doing wonderful at this time.
Wow. Love to hear that. Thank you for sharing.
We do. You know, it's empowering when you receive this information ahead of you know, something maybe really scary when you go to the doctor. Let's talk about those cancer screenings that you also provide for your patients.
Yeah, so we have an outstanding radiologist, Dr. Ken Daughters, who's doing our cancer screening. When someone comes in for a heart scan, simultaneously we can do a cancer screening. Once we have someone on the table, it takes about 5 to 6 seconds to scan their heart, and an additional 7 or 8 seconds to do a full body cancer screening. We had another pretty exciting feedback piece of news this week. We had a patient that came in about 3 or 4 weeks ago, asymptomatic, in her early 60s, had a cancer screening and had a worrisome looking mass on her pancreas. And pancreatic cancer is always a really scary and often very difficult diagnosis, often without a cure. She subsequently underwent surgery. It was an early cancer. They got all of it, and she's doing great. So we put her in the win column as well.
Amazing. Literally saving lives. You haven't even been open that long.
Yep.
It's really incredible. I know you said there are some heart attack statistics that are startling. I think there's one every 40 seconds?
That's right, yeah. So heart disease still is the leading cause of death in America by far, and heart disease, unfortunately, is on the rise right now. So, you know, one of the problems historically with cardiology and the care that's given is we wait until people have symptoms or until they have a heart attack. And the frightening thing is half of people who have heart attacks, that was the first symptom they ever had. So clearly that's not the best way to approach that problem. So with this technology, we can take anyone, put them on our scanner, and then let them know. Often it's peace of mind. We give peace of mind and reassurance that your heart looks great, keep doing what you're doing. More often than not, we find that people may have a little or moderate disease. And actually, one of the frightening statistics that we found in the first, 200 or 300 people that we've scanned is just about 1 in 3 people have moderate or severe disease. And these are people that are asymptomatic, just coming in to get checked. So the good news is, even when you find that, no one's ever excited to hear they have blockage in their arteries or plaque buildup. But the great news is we can then really treat that aggressively, and some of that can be reversible.
Yeah, and pinpoint it. And the even better news, Dr. Kevin, he's got such great bedside manners. You are so kind, and you really truly care about your patients. I want to go back to our viewer who saw the segment, then called. He got in right away. So what happens when people call you? Do they know what scan they're looking for? What happens? Yeah,
so we have a team very committed. And really, this is what we care about, and it's the whole team. It's Jamie, Andrew, Amy, Erica, Russ, myself, everybody involved in these patients' care. We're going to do everything we can to put them at ease, get them in quickly. And one of the other huge advantages of coming to our clinic is, no matter who you are, you're going to get a phone call from me or one of our nurse practitioners to go over the results, answer any questions you have, and then direct your care from there if there's some kind of finding that requires further attention.
That's wonderful. Thank you, Dr. Kevin.
Thank you for your work.
Thank you.
Book your consultation today. Visit longevityhealthtn.com for more information and to get started.